So when you talk into the app, how do you? There's several things that happen. One is as far as the dictation coming out with the right words. How does that work?
So the recording is sent to a third party that I have a BA with, and there's several companies doing this right now, and I had to kind of run them all against each other to find the one that doesn't make as much medical word mistakes, and it gets transcribed within seconds. Like literally, a 5 minute conversation would take 2 or 3 seconds to get back, and then that content I'm setting to an LLM to have it analyzed. But the one thing I have been doing, and I didn't initially because I didn't have the hospital permission per se initially, was I started redacting it right off the bat. Anything HIPAA. There's 18 items that constitute a note to be HIPAA compliant or HIPAA variables. For example, the patient name, telephone number, address, date of birth, social security number, etc. So I'm redacting those at hello. So I'm not dealing with any patient health information. And in fact, you don't need it to write a good note. You need the age, the sex, and the story of what happened. So initially
So
that,
if you take that out, so I'm going to interrupt you because I think it's helpful because I don't understand everything. So I'm going to interrupt you at different
sure,
points, even though it feels like I'm
sure,
stop saying I want to explain this. I For my clarity, and I think for the audience clarity, so that when now I lost my train of thought explaining why I'm interrupting you. um, when as far as keeping track of this information.
right.
So if you're redacting out the HIPAA information, the information specifically about that patient, how do you make sure it gets back to the right patient? How does the
So you're labeling each encounter with diagnosis, age, sex, and room number. So you know who it is. It becomes a patient health information when you take it out of my app and put it in the patient's chart. Then it gets linked. Then that becomes patient health information. Before that, it's just a clinical story. So I keep telling like this, what I like to compare it to is like a medical calculator. 4 + 4 = 8. My calculator gives you 8. Where you put that 8 matters. That's the key. But if you grab my phone, you go through it, you're gonna see some interesting clinical stories, but you won't know who they were, what they were, when it was. It's obscure. And in a way that's protective as well, because I am following so HIPAA guidelines, which all hospitals abide by, all medical facilities abide by, require end-to-end encryption, which I do. It requires anything stored to be encrypted, which I do. It requires you to have a business associate agreement between the vendors and the users, which I do. And I feel like mine is an extra layer of protection because if almost every system gets hacked, I'm not saving recording, I'm not saving any data, I'm not saving anything. You hack into my system if you capture any of my notes before the trial, where I think I'm keeping them 30 days right now. It won't be of any use to you. What are you going to do? Just a bunch of clinical stories.